You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast. Hey, everybody. Welcome back. This is the NeuroRESET podcast. We have a lovely patient with us today. We've got Erin, agreed graciously to share all of her wonderful experiences with us. But one of the main things that we're trying to do here with the NeuroRESET podcast is really to help everyone else out there understand that there are things that we can do for chronic and complex neurological conditions, chronic pain, especially when you've been everywhere and you don't know what to do and you're not getting results. Like functional neurology and what we're doing in this office can certainly help people. And so we brought Erin along to kind of, number one, get to know her and help you guys understand that real people are sharing their experiences, number one. And number two, she has been through it. She's gone through injuries. She's been through basic stuff. She's been through more complex things. And really just wanted to have her share the word instead of me sharing her word. So welcome, Erin. Thank you so much for being on the podcast.
Thank you for inviting me.
Of course. And so tell me just a little bit about yourself. Like, I see you're in Scrubs. You don't work with us, but
I don't.
So what do you do for work?
So I am a CT technologist, and I work at an oncology center.
Okay.
I used to work at a hospital for about 9.5 years before that, but I've been doing CT for 10 years now. So I have worked in the emergency setting environment, and now I work outpatient. So I'm starting IVs on patients.
Okay.
I'm seeing the scans as I scan them and taking care of them throughout the day. So.
Okay. So, you'd mentioned to me, actually, I think it was last week or the week before, oftentimes you've been doing this long enough, you develop a skill set, you work hand in hand with doctors, right? That treat these patients, and being on the job long enough, you pick some things up, right? So oftentimes before the doctor even walks into the room, you almost know what you're looking at. And so tell me about that. Like, what is that like?
Well, especially I'll go back to my ER days when I'm scanning patients that are coming in generally unresponsive, or if they're coming in for a stroke. I scan them. I'm able to see what is happening in their brain, anywhere in their body that we're scanning. So most of the time I would see patients that had brain bleeds, or they would have a pulmonary embolism, or their aorta is dissecting. So we are seeing what is going on inside of their body in real time as we're scanning them.
Wow. So
we know what's happening to them before we actually even send the images over to the radiologist to read them, who then creates a dictation and a report for the ordering physician, such as yourself, ER doctors. Then the ordering physician is able to see the report of what is happening with this patient. So after we scan the patients, unfortunately, when they are conscious, we have to go back in and act like we do not know anything.
Oh, wow.
So
it's got to be tough.
So it's more stressful, especially in oncology too. Because where I work now, most of my patients I scan every maybe 3 to 6 months, or if they're changing their chemo treatment, if they have to get radiation, I'll scan them.
So they already know that something's going on, whereas in the emergency situation, they didn't always know.
Correct.
Right?
It's like their initial diagnosis.
That's where bedside manner can come in, right? Yeah. Wow.
Yes.
So you touched on stress a little bit. Actually, before we get to stress, would you mind sharing kind of how we connected in the first place?
Oh, of course.
You can share as many details as you want, but ultimately I'm looking to see if there's anybody else out there that's really looking for help. And, if it resonates with them, then we can get them some help wherever they are, hopefully in the world.
Oh, definitely. So back in June of 2021, I was in a car accident. I was driving through a green light. The other individual decided to take a left-hand turn as I entered the intersection, had less than a car's length to stop, so I slammed into her at 40 miles an hour. So back to my ER experience. For me, I thought it was fine because I could walk and talk, which is better than most of the patients that I have scanned that are, not able to walk and talk. So in my mind, I thought it was fine because I could walk and talk. I didn't really realize the impact to my brain from that forward slamming of my brain. Is it the contracoup?
Contracoup. Yeah, basically it's when you basically get a whiplash of the brain. So it hits the front part of the cranium, right, in the backside of the skull, and that creates like a forward-backward kind of oscillation.
So about 40-mile-per-hour impact.
Yeah.
Would be, yeah. So besides I could walk and all that, I didn't really realize until probably about a week later that I was having a hard time with working, because at work I have to multitask. I'm paying attention to, as a patient is getting scanned, I have to react if they have a reaction. If I see a critical finding, there's a lot of things that I'm actually paying attention to. That before the accident, I didn't realize how much multitasking I was doing, just because that was what I was used to doing.
It's just automatic, right?
Yeah, it's automatic mode.
And so, if I'm going to throw out there, it sounds like you had a concussion, right? That's how you ended up in our office, and you realize that the function of your brain wasn't up to speed of where it was, right? There were some other things I think associated with that, maybe like headache and some light sensitivity. I don't know if you had the sensitivities. I can't recall.
I definitely had noise and light sensitivity. I was sleeping a lot. I would forget that I started tasks. I realized when I could not multitask at home, I started making breakfast and forgot I had put oil in a pan. I was making myself coffee, completely forgot about that until I turned around and saw smoke in the pan. And that was one of the indicators that, okay, like my brain is not functioning properly right now. Besides that, understanding simple conversations I was having with my mom, it was almost like, the best way I can explain it is that she was talking to me like in a foreign language, because something simple that she was trying to explain to me just was not making sense.
Wow.
So between that and not being able to really do my job and multitasking, memory, and sleeping a lot, I did see one doctor initially who took initial care of me with my concussion and was helpful, but I just still was not feeling completely back to normal. I was still having some issues with balance. I couldn't read for extended periods of time.
And you love reading.
I do. I love to read.
I'm a bit of a book. She's got every time she comes in, she's got like a list of things. It's either whiskey or books that we talk about, right?
Yes.
So
yes. Exactly. So I mean, I just purchased more books, so I always have plenty of things to read.
Yeah.
So when I worked back at the hospital, one of the radiologists I used to work with had come in to see you for his 2 concussions that he dealt with. So when he learned of my accident, my concussion, and the problems that I was still having when I was trying to still work, he gave me your number. And I'm very thankful that I came in to see you, because not only did you help out with my balance, which for me is very important as someone who is very active.
Why is that?
With yoga.
Yeah.
Yes, yoga and lifting weights and even hiking. Like, I need to have my balance. And I was having major problems with my balance. If I turned around too fast, I'd usually kind of fall into the wall or whatnot. And I didn't realize that my eyes were not tracking until you did my the test with my eyes, and kind of learned, like, this is why I'm having issues reading for more than 10 to 15 minutes.
Yeah.
So I came in to see you, and you took excellent care of me. Between working on my cognitive skills, you also assisted me with, I didn't realize that I was having issues with my vagus nerve, because I wasn't feeling hungry. I was having some digestive issues, but I didn't realize that I was having those problems until you started healing me. And I actually felt hungry, which I didn't realize I hadn't felt hungry in so long, because I was dealing with so many other symptoms and issues that my digestive tract, I didn't realize was also affected.
And the more we get to know you, the more we know that eating is one of those things that you enjoy, because you prep every meal. You have a meal here in the office sometimes, and it's just nice to hear that. It's nice to hear you just describe what so many other people are describing, because they don't understand what's going on. You didn't understand at the time either, and it's not usually till after the fact, when it comes back, that you realized it was gone.
Yeah.
And it's just, concussions are really weird. They're different in every patient, right? Like, how many symptoms have you seen with imaging, but the bleeds are in different places, So the brain is very dynamic. While you might look at the map, there's 100 different ways to get from point A to point B. And so that's the cool thing, being in our shoes, trying to figure out how to fix those things that we see. But yeah, like in a concussion, we've got the physical trauma to the pathways. We've got the integration that those pathways then lose their function, which is like multitasking and the other areas of the brain that you're describing. And then we have a tolerance thing, right? So,
yes, definitely tolerance.
And so, when I talk about tolerance, it's like I can tolerate maybe 2 minutes of a conversation with my mom, whereas before I could tolerate 30 minutes or an hour or a 5-hour car ride,
Yes.
and it was totally no problem. But when you start hitting those walls and you exceed that tolerance, that's usually where symptoms kick in, right?
Oh, yes.
And those symptoms can show up in any which way. They can be brain fog. They can be confusion. It can be headaches. It can be the light sensitivity kicks in. It could be your balance starts getting wobbly. You could get irritable, right?
Irritable, yes.
And
that's something I dealt with, and I had not dealt with that before.
Yeah. And,
and anxiety.
Exactly. So the parts of the brain of the front lobe. The front lobe deals with our ability to basically calm our system. So if we're not calm and the front lobe's broken or injured, what's going to happen? We're going to go the opposite way. We're going to get irritable. We're going to turn into anxious people. And it's not any fault of our own necessarily, especially in this kind of situation where you get a concussion because somebody cut you off. And so that's the tough part is in that situation where you were injured by someone else, you luckily had this really great work ethic and mentality of positivity before you were injured that stayed with you through your injury. So you were dedicated to getting better, as opposed to some individuals aren't as positive, and when their brain gets injured, they become very negative people. So that makes their recovery process that much harder than yours was.
Oh, I bet you that
as
would
an
be very
example,
difficult.
right?
Yeah.
And so, psychology goes a long way in healing the body, healing the brain. And when people take that into account and we actually are able to work through it and, give techniques and tips and maybe don't do this, maybe be a little more positive. It's obviously harder than that. Just be positive. Most people don't realize they're being positive, but people that go from being in a bad place to being positive again, it takes work.
Oh, it does.
Right? It's just like hitting the gym.
You have to adjust to, I refer to it as the post TBI, the new me, because there is that change from what you knew yourself to be functioning as before your brain injury versus after.
Yeah. And I'm hoping at this point, we're pretty much back to where we were before. I mean, I'd love to say yes, but
I feel like for me, even changing my diet and not even diet, my lifestyle, my nutrition, that was a big game changer for me too. Just, I still focus on supporting more of the anti-inflammatory lifestyle.
Yeah.
Especially reading that Green Brain book.
That
was a game changer with understanding the neurological effects of things that we eat.
And as I recall, that was actually in the middle of your concussion.
Yes.
That you were reading that. Yeah.
It took a while to read that.
It did, right? But now you're reading, how many books do you read in a week at this point?
I mean, not a ton because they're very intricate books. So
they're
there's
this
a lot
thick,
of,
right?
Yeah, there's
it's
a lot
the
of
old
information. But I'm reading more in depth, a lot of neuro, I don't know, neuro is just very interesting to me. Right now I'm reading about just kind of our pain and pleasure balance and everything. Yeah. So it's, anyways, but yeah, you really helped me focus on my body as a whole, whether it's doing the different neuro exercises that you would give me. I'd do those exercises at home when I came in and saw you.
Yep.
So you gave me tools for me to use on my own to help out with my body healing.
Right on.
So for me, I just kept that focus even now that's why I came back to you after, it's been over a year since I came back, and now you're in this new awesome office, which is amazing.
Thank you.
You're welcome. So I was really excited to see you again, but that was just one of my goals, was to always come back and just to fine tune just some of those post-concussion symptoms, especially my anxiety and anger that I didn't really deal with. I remember telling you about a driving situation when I was going to see my sister in the hospital. And I didn't realize that the feeling of your brain spinning like a carousel, that's how I explained it to you, because that was the best way I could explain it. It's my brain felt like it was spinning on a fast carousel ride. And you're that's anxiety. And I had never dealt with anxiety before. So that was a post-concussion.
Yeah.
Yeah.
You kind of touched on an interesting subject, especially with car accidents. In the medical legal world, there's often only so far that we are allowed to treat, and whether it's coverage or a certain performance rating that we can get to, it could be a limitation of the office that you're in, right? We might not have had all the tools that we have now that was the missing link to getting you all the way to where you needed to be. And so in the car accident world, it's really kind of difficult. It's difficult, but it's not, to get that person all the way back to where they were. And it's always a struggle, a fight within that med legal community between the attorney, the doctors, the case, the insurance company, and all those things. It can get really complex. And so anytime we work with a car accident case, our goal is to get you back to where you were. That's like the med legal side, but we know that you can do better. And so as clinicians, we just want to keep going and get you back to this point where you're like thriving. You know, and so when you came back and you're like, hey, I've still got these things left over from the concussion, I was like, like, shoot, like I didn't do my job, you know? And I honestly don't remember if it had to do with me not having the skill set at that time a year ago, or if it was anything to do with the case. But
it was more to do with the case.
Okay, cool. Whew, thank goodness.
Yeah, it wasn't you.
But, you know, now here we are. We're, I mean, just a couple of months into optimizing some of this other stuff. And it was really, I mean, there were some things at work that were triggers, right? That we didn't realize were putting our, call it our RPMs and our threshold. And that was changing that to where we'd have some symptoms. And now we worked through some stuff on our end to strengthen your brain.
Yes.
At the same time, some things at work have changed, but it's been like a twofold improvement. And it was like really pretty quick once we kind of got it dialed in.
Oh, definitely.
So that's it for me. That's a lot of fun to watch. And you're just like one of the best patients because you do everything that we could ever ask for and probably then some. And you're just so like self-taught and interested in the subject. So I really appreciate you as a patient. So thank you for, you know, giving me a second opportunity to really kind of optimize that brain of yours.
Thank you. Well, you not only helped me with my brain, but when I was having hip pain, you helped me with that as well.
That's right. I forgot I'm a chiropractor too.
Yes.
But yeah, that's, you know, that was relatively short-lived, you know, 2, 3, 4 weeks maybe. Then you have a little shoulder thing pops up, and we kind of work with that, but all while focusing.
I realized what I was doing at work and fixed my...
So it turns out the multitasking is working just fine now.
Yeah.
Right? Yeah.
Well, I'm great with multitasking.
She's working a mouse over here while doing something over here, and she's like, wait, why am I doing that?
Like, why is my shoulder hurting? Why did it go? I keep doing this.
Oh, that's too funny. So kind of the last question I have is what kind of exercise, like how did I train your brain? In your eyes, what did we do? Like what kind of exercises, what kind of tools, light therapy, things like that might have we used?
I do remember I had to do this little like march.
Yeah.
Like that. And then you had me saying phrases backwards. There were usually, I think, 4 to 5 word phrases. You would tell them to me the regular way, and I'd have to, as I'm walking and turning my head, I would have to tell you those phrases backwards. I also remember that big touch screen where I had to draw like the shapes, but you would tell me how it was like needed to be rotated. And then you always thought it was funny because I had to have my lines straight, but I didn't know why that was so funny because I don't know who likes
inside, right?
I was like, I don't like crooked lines.
Yeah, that's too funny.
So I do remember because that would be more of like the cognitive.
Yeah, you know, so we'd work on frontal lobe, parietal lobe, integrating the two, and then the complexity of it would be the rotation, right? So that internal, where am I in space and where is this box in space or the shape, and have to rotate it and connect those dots. So we're really putting a heavy emphasis on the back side of the brain, but also shifting and making the front part of the brain work too, the more complex things got, right? So it's fairly, well, maybe not in the concussed brain, but it's fairly simple to like run or march. If we have you do that and we have you talk at the same time, often people break down because they're not used to thinking about moving. They just move. When we make them think, it's a higher cognitive function, like a frontal lobe function.
Okay.
And so when I ask you to march and say something, it's like extra frontal lobe function. And so if we see breakdown, or you're like, wait, which arm, what leg, what was the word? And so when that's like this whole autonomic thing where we have to get blood flow to all these different places at the same time efficiently to get the job done and then do it again. And so that's where tolerance training comes in, is we only do what you can do, like we maybe drop a word or slow down the marching so that you can do it effectively. So we kind of sort of get all the blood flow there. And then you're like, oh, I get the hang of it. Then all of a sudden we get all the blood flow there. And so that's what helps your brain heal, is getting that blood flow to all the right places at the right time under the right amount of stress to your brain. Call it an exercise or breathing or whatever we do.
That's like the neuroplasticity.
Yeah, exactly. And that's what creates neuroplasticity, just multiple firings of the same type of pathway, which is learning a new skill, learning a new language, learning a new like exercise. Your cardiovascular system kicks back in, your balance system kicks in when you do yoga, things like that. And so the more we do it, the better we get at it typically.
Yeah.
And then we throw in the chemistry stuff and we work on the body, right? So really the three main things we work on are brain, body, and biochemistry. We put those together and it's really hard to not have a good outcome. And so, I'm just really excited that you were able to share your story today. So thank you so much for hanging out. This is technically our first podcast where we actually had the audio working, and I think the cameras are working.
Yes,
and
hopefully.
I hope I'm not too shiny because it was a long day of work. But I really do thank you for coming in and kind of sharing your experience,
you're welcome.
giving hope to people out there that have had a concussion and are dealing with some of the same things that you had dealt with.
Yeah,
So,
I just feel like it's kind of a new me, but a better me. So I definitely know I would not be where I am today if it wasn't for you.
Well,
so,
thank you. And I didn't pay you to say this, right?
No.
Okay, just to be clear, right?
No, it's just the truth, though, because I know if I hadn't reached out to our mutual friend, then I would not have I didn't even know what a functional neurologist was. I didn't even know that was a thing until I came here. So I was like, wow, like this whole new world.
There's a song that goes with it, right? It's like a Disney song. Well,
I will not sing.
I won't sing either.
Sorry, you will
Rihanna
go deaf.
can sing.
You will go deaf if I start singing.
Well, I'm not going to take
you.
up. You're welcome. Thank you for thanks for just being a great patient. I really appreciate it. It makes our jobs on this side so much easier.
Thank you. Did I get an A+?
Absolutely.
Okay, good.
Double plus,
Okay,
105%. So, okay, well, thank you everybody for tuning in to the NeuroRESET podcast. This is Erin. Thank you, Erin. If you have any questions on, dealing with concussions, how to move around it with the brain-body biochemistry, please reach out. Let us know. We can help you be a resource, or we will be a resource for you. Try to get you in the right hands to get you on your way to recovery. All right. Thanks a bunch. We'll see you next time. Thanks a lot, Erin.
Yeah, you're very welcome.
All right. Bye.
Bye.